It's 3 in the morning. The house is quiet, and your dog is standing in the middle of the kitchen, completely still, staring at the wall. Not barking, not asking to go outside. Just standing there, like she's watching something that isn't there. You say her name. She doesn't turn around. Here's what should bother you about that. There is a very good chance her veterinarian has no idea this is happening. Not because you haven't said anything, but because even when owners do bring it up, the conversation tends to end the same way. She's getting older. It's probably just age. Let's keep an eye on it. But behind that wall she's staring at, something specific is happening inside her brain and her body. And the night, specifically the night, is making it worse in ways that have nothing to do with coincidence. By the time this video is over, you will understand exactly what she's trying to tell you, why it gets louder after dark, and what you can actually do about it when you turn the lights off tonight. There's also a question that most guides skip entirely. How do you know if it's pain, or something happening in her mind, or both at the same time? That answer changes everything about how you help her. We're going to get there. But let's start with the thing almost nobody tells dog owners, and the reason most dogs going through exactly this will never get the help they need. 75%. That's the share of owners of dogs 7 years and older who noticed at least one behavioral change consistent with cognitive decline. 75%. And of those, only 12% ever brought it up to their vet. Then there's this number, and this is the one worth sitting with. Of all the dogs who actually have canine cognitive dysfunction, only 1.9% ever receive a formal diagnosis. Published in the Veterinary Journal in 2010, that finding hasn't changed much since. Not because the condition is rare, because everyone, owners and vets alike, keeps calling it old age. The instinct is understandable. You've watched this animal grow older. You've adjusted your expectations alongside her. The long runs became short walks. The short walks became slow ones. You adapted because adapting felt like the kind thing to do. But somewhere in that process, a door closes. You stop asking what's wrong and start accepting that things are just different now. And the dog on the other side of that door is still trying to communicate something. Only now, nobody's listening in the right way. So let's start listening. If your senior dog is getting up multiple times during the night, circling, shifting positions, lying down, and then standing again within minutes, there is a good chance she's in pain. Not anxious, not confused, not being dramatic. In pain. Here's the mechanism. When a dog with arthritis lies still for a stretch of time, blood flow to the inflamed joints decreases. Stiffness builds. The discomfort that was manageable during the day, when she was moving and generating warmth in her muscles, becomes something else entirely after an hour of stillness. Getting up and walking is not restlessness. It is relief. The movement is the only tool she has. Up to 80% of senior dogs have some degree of arthritis. And because dogs are extraordinarily good at masking pain, because that instinct runs deep and old, the arthritis in your dog's hips or spine or knees can be well advanced before you see a single obvious limp. What you see instead is the nighttime pattern, the circling, the inability to settle, the slow lowering of the body that stops halfway, like she's testing the landing before committing to it. There's something else happening at night that compounds all of this. The vision of an aging dog is not simply dimmer. It processes differently. Contrast drops. Peripheral awareness narrows. The house she has lived in for 10 years becomes, in low light, a slightly foreign place. Corners look different. Distances become harder to judge. A dog who is also losing her hearing, which is common in seniors, is now navigating that changed geometry without the audio cues she used to rely on to orient herself. The creak of a floor, the sound of your breathing from the bedroom, the ambient noise of a house at rest that told her, without her even knowing it, exactly where she was. At night, those signals fade, and in the quiet, something shifts. Picture it this way. It's 2 in the morning. She gets up from her bed in the corner of the room. You hear her nails on the floor. She walks down the hall. You wait for her to come back. She doesn't. You find her in the kitchen, standing against the wall, facing into it. You say her name. She turns slowly. Her eyes have that quality. Not blank exactly, but somewhere else. Like she's seeing you from further away than the 6 feet between you. You take her back to her bed. She settles, but an hour later, you hear the nails again. If you've recognized your dog in any of that, stay with me. Because what comes next is where most guides stop. And it's the part that actually changes what happens when you turn the lights off tonight. What you may be watching is a condition called canine cognitive dysfunction syndrome. The fact that it gets worse at night, specifically and consistently worse, has a name borrowed directly from human medicine: sundowning. The parallels between this condition and Alzheimer's disease are not superficial. They are biological. Affected dogs accumulate the same beta-amyloid plaques that form in the brains of Alzheimer's patients. There is the same neuronal loss, the same inflammatory response, the same progressive disruption to the brain regions responsible for memory, spatial awareness, and sleep regulation. Researchers studying canine cognitive dysfunction now routinely use dogs as a naturally occurring model for Alzheimer's research because the disease in both species follows a strikingly similar course. Here are the numbers. 28% of dogs between 11 and 12 years old show at least one sign of cognitive decline. By the time a dog reaches 15 or 16, that figure rises to 68%. This is not rare. This is aging. And the dog standing at the wall at 3 in the morning is not being dramatic. She is disoriented at a level she has no way to explain. Now here's the piece that tends to change how people think about all of this. Pain and cognitive decline are almost never separate. When a dog lives with chronic pain, her body maintains a low-level stress response. Cortisol stays elevated. Elevated cortisol disrupts sleep, increases sensitivity to stimuli, and generates a background anxiety that doesn't resolve with the pain medication alone. Treat the arthritis, and the nights may still be broken, because now there is anxiety-driven sleep disruption layered on top. Try to address only the anxiety without touching the pain, and you're quieting one voice while another keeps going. By the time most owners are watching their dog pace at 2 in the morning, the line between where the pain ends and the fear begins is genuinely hard to locate. The two conditions feed each other in a loop. Understanding that loop is the reason the next part actually helps. When you talk to your vet, bring specifics, not just she's restless at night, but when it starts, how long it lasts, whether she circles, whether she gets stuck in corners, whether she vocalizes, whether she's been having accidents indoors even after a late walk. That pattern is diagnostic information. It helps your vet distinguish pain from cognitive dysfunction, from anxiety from something else entirely, like a urinary tract infection or a thyroid issue, both of which can cause nearly identical nighttime symptoms, and both of which are fully treatable. Ask about orthopedic bedding. It is functional support for joints that hurt when pressed against a hard floor, not a luxury item. Ask about structured nighttime routines, which reduce the disorientation that comes with cognitive decline. Ask about night lights, which sound almost too simple, but can meaningfully reduce the visual confusion that sends a dog wandering into corners. Ask about selegiline, the only drug with FDA approval specifically for canine cognitive dysfunction. ask about omega-3 supplementation and medium-chain triglycerides, both of which have evidence behind them for supporting brain function in aging dogs. There is a list of things that can be done, not everything, but enough to change the quality of her nights and yours. If this is the kind of content that makes you want to actually understand your dog rather than just wonder about her, there's more where this came from. Subscribing takes 2 seconds, and it means that the next time she wakes you at 3 in the morning, you might already have a better idea of what to do. Your dog has spent her entire life learning to communicate in a language that doesn't belong to her. Every behavior that seems strange or sudden, the pacing, the wall gazing, the slow circles before she gives up and lies down, is part of that attempt. The fact that she's still trying, at 12 years old, at 14, at 16, even when the signals get harder to send, is not something to feel sad about. It's something to meet halfway. You turned the lights on when she was standing at that wall. You're here now, finding out why. That's the only thing she ever needed from you.